listening to Planet Vero Radio. I am Cindy Schwartz. We are broadcast on iHeartMedia and also podcast on Spreaker. I've got Jeannie Roller on live stream with me from Indiana. Today we are talking about, Jeannie, some of the cases that you and I have been talking about off the air. Some of the ones that have been in the news pretty prevalently lately. The Uvalde shooting is so horrific, and also the Tulsa shooting about the doctor. And I want to say on air that I did contact some of the people that I thought could give me some information about maybe that they would look into the background of what happened, what triggered this person to go into a doctor's office, a doctor that he had seen and had an operation, had a surgery from, and apparently in the patient's mind, something had gone wrong and things didn't work out the way that they were supposed to, and he was in pain. Obviously, I mean, that's been all over the news that he was in pain. And so I asked the people involved in some of this, has anyone looked into the specifics on why this certain patient would go back, quote unquote, to the scene of the crime and commit a horrific crime? I mean, it is a horrific crime. I don't want to see anybody get killed, but I want to know if anyone in that hospital, the doctor, his staff, there's always an office manager, nurses, there's the hospital admin, there is joint commission, there is risk management, there is the patient advocacy program that are in all of these big institutions, all these big facilities. Had any one of those entities gotten involved, the board of directors that are in charge of giving a certain quality of care, a certain face to these facilities so patients feel safe and feel trustworthy, that they can trust the people that are working on them. Have any of these people been approached? Certainly you don't have to answer me. I mean, I'm just a person that does a podcast about harmed patients, and we do talk radio about harmed patients. Misty Roberts is on patientmodesty.org. Jeannie Rolla, we're on info@patientrightsinfo.com. There are other people, Dignity Resource Council with Robin Leonard, that goes on and on, the people that we talk with, that we interview, that are so concerned about what happens with harmed patients and that nothing gets done when you go back to complain. And I'm not saying that we're habitual complainers. I mean, I'm not. I am just bowled over by what happened with me with my surgery for lung cancer, and the stories that you and I, Jeannie, have interviewed and have listened to, just heartfelt stories. I mean, I've sat here at this microphone and cried when I've heard some of the things that have happened, and other times I'm just mortified. Other times I'm so mad. And, it goes on and on, that people are telling us these stories, and they just went to a doctor legitimately enough, trustfully enough, to have a procedure, to have a surgery, and look what happens when something goes wrong. And again, for the millionth time, we've recognized that people make mistakes, but where does the help come from? When something happens, where is that committee? Where is that helpful situation that says, okay, let's level the playing field. Something here did go wrong. Let's fix it. And I'm hoping that, and I never want to see this happen again, and what happened in that Tulsa hospital, I'm hoping that hopefully my contacting some of these people, and some of the people that we talk with contacting these people to this specific crime, opens up some kind of a window or doorway, whatever you want to call it, to say, this is happening. Let's do something about it. Let's try to fix it. We don't need more shootings. Jeannie Roller?
Well, Cindy, there is no help out there for harmed patients. I mean, how many of us have read that medical mistakes are the third leading cause of death? That's not accounting for the people that are just harmed. I don't even think that accounts for the people that are intentionally harmed, like the ones who have procedures without consent. So, there is nothing being done about this. So, I don't know when it will stop. I read articles, many, many articles from the medical community saying that they feel like patients are harming them, that patients are becoming violent with them. But yet the medical community itself never seems to be able to acknowledge that they are harming patients to the tune of being the third leading cause of death in the United States. So as long as the medical community is not trying to do anything about harming patients, but rather are reacting to patients harming them, I don't see how it will stop, unfortunately, because people have lost their confidence and their faith in the medical world. During the past 2 years, they've seen a lot of things that makes them question what happens. Plus, then you have people who are actually suffering harm other than from the last couple of years. So until there is a willingness for the medical community to sit down and discuss with some of us harmed people, patients, I don't know what the answer is to end it.
Yeah, we talk about it all the time. I mean, the answer is that it needs to be brought out and needs to be talked about. I mean, people just do not wake up one day and say, okay, here I am. I'm Cindy Schwartz. I'm going to call up this surgeon at the Orlando hospital. I'm going to complain about him just because I feel like complaining about somebody. I mean, people aren't doing that. People are not doing that. Some of it be relegated? I don't even want to open that door, but can it be relegated to something being frivolous or novel or something? Probably a minute percentage of that, because I can hear someone saying, oh, well, there's how many people really are harmed? Well, there's millions. You know, is it just because the Band-Aid was put on the wrong way? No, that's not what we're talking about. We're talking about interaction with drugs that people have allergic reactions to. We're talking about people that are stripped naked, kept naked. We're talking about allergies and stuff that people have that are on their charts that weren't even recognized or adhered to. We're talking about the nurse in Vanderbilt Medical Center in Nashville that blew through how many protocols, and the patient died because of the medication that she was given was highly volatile, and it stops your breathing apparatus. It wasn't that she just woke up and gave the pill. She blew through how many protocols, and that wasn't Go ahead.
18. I've read
18 protocols. So even if it's half. It doesn't matter. Even if it's one, you blew through a protocol that was in place. It's like they came up with the protocols for sponges. Okay, we got to have 3 people counting it. Hopefully 3 people actually do count it. I mean, I kind of question that sometimes from what I've seen in my own medical care anymore. It never used to be that way. That you'd question it, but hopefully these protocols are in place so the medical community adheres to it. The other side to it, and we've talked about it too. We talked about it before going on air today. Is the lack of education for people that are now working in the medical field. I mean, Vanderbilt Medical Center now is hiring what? Custodians, those kind of people. Go ahead.
Right. Anyone that they can. Because they say there's a shortage, so they're taking people from within and training them to become medical assistants.
Okay, so there you go. And what does that training consist of? I mean, yeah, you don't need a PhD to be a medical assistant. Certainly, I know that. I mean, I'm not crazy. I mean, they're not taking a custodian and making them here, a cardiac surgeon. All right, we get that. But there are some, and we've interviewed RNs that say that when they were in the beginning of this, when they started doing medical assistance, from custodians and whatever, they're not given the whole medical apparatus of people, and we only have like 30 seconds left, that people normally used to be trained to and now aren't. And so a lot of the stuff is like just pushed away, pushed aside. And you have a secretary, in essence, or a cashier at the 7-Eleven that now is your medical assistant and is your surgery tech. Those are that's what we're dealing with in these ORs. Because in the state of Florida, and I know nationwide, basically there's no certification or licensing for surgery tech. So there you go. Another show on Patient Partners. Please stay tuned to Planet Vero Radio.